Do you give much thought to your pearly whites? We probably all think about brushing and flossing, but what about your bite and how that can affect the rest of your head, your neck, your health in general? It's something that Dr. Dwayne Keller from Keller Professional Group and his patient Amy Zabel think a lot about. And that's because Amy had something called Meniere's disease. For 20 years she was battling this before she finally found help. And that basically left you incapacitated. Is that a fair word for it?
That is correct. It was debilitating. I couldn't go to work. I'm a school teacher, so it was really important for me to be there. And I missed like 19 and 20 days of work a couple of school years. And so basically they were saying, you know, you're going to have to retire. It's a grim diagnosis. I went to all kinds of doctors and they just didn't have an answer for me.
And you're getting the same answer over and over, which is you're just going to have to deal with it, basically. Do you have any idea what caused this in the first place?
I didn't know, of course, until I saw Dr. Keller. The thing that the ENTs and the ear doctors said was that I had a fluid buildup in my ear, and the fluid was leaking out, causing the dizziness. And so they gave me some options, surgical options, 50-50 shot at being successful, and I just wasn't willing to accept those kinds of odds. So
I want to hear about how you hooked up with Dr. Dwayne Keller in a little bit. We'll circle back to that in a second. But first, Doctor, you say that this can sort of start with conventional orthodontics. People with a good idea in mind, maybe, but it's misguided.
Well, a lot of conventional dentistry doesn't always treat to the best functional jaw position, bite position. So what we try to do is find, A, what the dysfunctions are, then in our first phase find a better working structural, functional, postural relationship. And that's when we were able to do that with Amy. We were able to help her, you know, get over the dizziness and the headaches and that the problems that she was having. And then we've maintained that relationship now as we're almost finished with the orthodontic portion of it.
And you say almost finished. How long has this process been? And will there even be sort of a continuing effort beyond? Or does there come a point where she's going to be back to a regular healthy jaw alignment, healthy head?
She'll be in a position where she can manage and maintain this. We'll try and follow up with Amy maybe once a year. But on the average, you're talking 2 to 3 years of active treatment once we get them stabilized. And that's something that, you know, it does take time. This isn't something that occurs overnight.
But, as I'm sure you will back me up, Amy, it does sound like a long process. A couple of years, a few years. Is it worth it?
Definitely. Dr. Keller and Dr. Hereford over at Core Services, physical therapist, have just been unbelievable. They've given me my life back. And, you know, as Dr. Keller said, I had no idea that braces could actually be the cause of what was going on.
Who would know that?
No one.
Nobody would know that.
Exactly.
So I'm so glad that you two were able to get together. And you travel from how many hours outside of the area to go see?
I'm from the Atlanta area, south of Atlanta.
There you go. That's all you need to know, folks. People are coming from around the country. Dr. Keller, Amy, thank you both so much for being here. We really appreciate it. If you're experiencing any of these problems, Dr. Keller can help you out. In fact, if it's not something like this, but a different jaw issue, he's probably seen it before. You can give him a call, 314-638-4190. You can always check out his website, too, drdwaynekeller.com, to learn more about TMJ and some of these other conditions.